we were having a discussion about whether or not we thought that it was ever going to go back to the norm that we knew of healthcare before. And I really don't see that happening. I think that where it's appropriate, there will be ER visits. There are going to be continuous emergencies. There's going to be surgeries. There's going to be touch-oriented procedures that have to take place, obviously, to troubleshoot. But other mechanisms are becoming so much more sophisticated in our ability to capture pulse, capture, all of your vital signs, your current temperatures. Even the digital workers can read temperature as a patient starts to walk in, right? So using the infrared cameras. So it can alert without having to go and scan, or use the scans to do that. The telehealth visits are becoming more sophisticated with being able to capture, from scanning your ID and scanning your insurance card. One of the girls in our discussion, she said, I just finished a telehealth visit and I was trying to hold up my little card to the thing because, they didn't have a way to scan that. But it's becoming much more efficient being able to just snapshot that with your mobile phone, have that upload. The digital worker reads all the information and initiates the steps that it's going to take to get that patient seen. That is all upfront work. That's not back office anymore.
Right.
I just walked through that journey and none of it was back in the back office where that one person that is stuck back there with the bill saying, oh my gosh, we should have done this. That's retroactive. We're bringing it proactive and making that a part of satisfying the criteria that needs to be done up front, even if it's, something like a glucose check. Those are even available now through the use of your biometrics in your mobile phone using osmosis. It's really exciting stuff.
It is. And we've been looking at telehealth for the last year. We've done a couple of surveys. We've done some surveys on wearable tech. And in the survey that we released in early March, one of the questions we asked were people's willingness to upload their personal data from a personal health device. Mm-hmm. A Fitbit, watch, whatever, Apple Watch, whatever the case may be. And more people are comfortable with the idea of being able to move that information into a telehealth platform so that their caregiver can look at it. Right. I think many caregivers are still a little are a little unsure about some of that technology and how accurate it is. I get that, but I think we're only going to see exactly what you were describing. You're going to see more and more of that. And it's funny, my own personal physician has a kiosk in his office in the waiting room where there's a sign that says, check in here. That was covered over by a sign, talk to somebody at the desk, right? So it's always such a slow roll in trying to get some of these new ideas out. And I think specifically when you're dealing with the patient intersection, when you're talking about that direct interaction with the patient, that's where clinicians can sometimes be a little hesitant, maybe reticent, don't want to engage.
And I think the physicians are seeing, their adoption to date maybe has just gone through an acceleration. Maybe, they say crisis breeds invention, and I think that has put most of the public in a place that they're more readily. I mean, if I don't feel well and I need some help, and I don't want to go in there, but the doctor is saying, this is the best way for me to get information to you, to get some meds to you, to make you feel better in a shorter period of time. Then I was open to do a virtual visit. Yeah. Okay. Did it take me a little while to get there? And I'm probably sure that other patients, even, those 65 and older that are even not as used to using technology as some, the young ones or the middle age, had even more reserve about, some just, I'm not giving my information to that machine,
right.
That kind of thing.
Absolutely.
But whenever it comes down to whenever it really starts affecting your health and you're really feeling bad, a lot of times that will push the envelope a little bit, or handing it off to a caregiver that you do trust and having them follow through with getting your information in a way that makes you feel secure about it. And we have seen that a lot. The home health agencies have really picked up in helping out with the virtual visits and the virtual events during this period, because the caregiver that's there with them every day, they seem to trust that they will manage that part of it and entering their information, getting their virtual appointment set up, and then they just need to talk to the physician. But the doctors are saying, like you said, the kiosk is a big thing for Blue Prism, the digital workers. We instituted kiosks in the UK in NHS all through their healthcare system, and they worked fantastic. Here in the US, like you said, there were some posters that were like, yeah, go see the front desk clerk. Because people just would not adopt the kiosk, or they had an adverse, everybody's touched that. They've all been sick. I don't want to touch that type thing, a phobia against that. So they would eventually wind up going to the front desk anyway. But I recently had a doctor say, we want to be past that. Just like if you're waiting on a table at a restaurant, you give them your phone number and they'll text you whenever your table is ready and you go on in. You're not sitting in there waiting to see to be seated or anything. Whenever it's done, it's done. Similar to that, the doctor said, can we get it to that level? I said, we can get it to that level with digital workers supplying the information saying, the doctor is seeing this patient. He'll be done in the next 30 minutes. So if you want to go on in for eval, we have a room that you can go into and go ahead and electronically take all of your vitals, or you can choose to see a medical assistant. Now, giving them a choice and an option somehow speeds up adoption. Isn't that strange? If they have an adoption, or they have an option to either use a human to do it or a machine, they'll say, okay, I'll try this first time. And then if they like it, then they'll continue to do it. So it's kind of strange how that acts. If you tell them they don't have any other option but to walk into the minute clinic and put in their vitals, then you'll get more resistance than if you offer them an option to see a person to get their vitals taken. So it's odd that it works out that way, but that's part of our patient journey. That's part of one of the processes that we have in patient journey, and starting to actually evaluate the bottlenecks in the processes and make sure that we cover all those bases with robotics.